Good afternoon, everyone. Welcome to the Office of Emergency Management and to the Emergency Operations Center. I started working with the Arundel County Office of Emergency Management in 2014, and even then, I was really impressed with the collaboration between the county agencies and the community. The whole community approach to preparedness, response, and recovery has always been exemplified by this county. I am proud to now be appointed as the Director of Emergency Management by County Executive Stuart Pittman. I would like to thank the County Executive for all of the support he has provided to the Office of Emergency Management during our response to this pandemic. He has helped unify the county agencies who are working tirelessly in order to provide the mitigation, response, and recovery to COVID-19. The county agencies have been working tirelessly to help protect the citizens and residents of Anne Arundel County throughout the whole community approach and Good Neighbor initiative. The county executive has also continuously pushed for greater collaboration at all levels of government to help combat our response and recovery to COVID-19. Thank you all for, thank you for all that you are doing for Anne Arundel County. And ladies and gentlemen, County Executive Stuart Pittman.
Thank you, Ms. Emmerich. We are very lucky to have you in this position, and I also want to thank Chief Tim Michaels for acting in this position at a very important time in recent weeks. So yesterday I put out a press release announcing some details about how Anne Arundel County will proceed with Governor Hogan's Phase 1 reopening. Those details are important, so I will review them, but before I do, I must address something that is, to me, much more important than that. It was 11 weeks ago that our schools were closed, then non-essential businesses were closed, then a stay-at-home order was put in place, and all of these decisions were made by our governor, and they were applied across the state with the support of most Marylanders, including myself. I held weekly virtual town halls from the outset. I made strong statements of support for federal and state action. I described outstanding work by county agencies to protect and serve our residents, and told stories of community groups coming together to support their neighbors. We were proud of what we had done, and so were most of our residents. We led the state in essential employee child care planning, public reporting on positive cases by zip code, strike teams in congregate housing, universal contact tracing and case management, a comprehensive health equity initiative, the first eviction prevention program, and the first small business grant program for customer and employee protection. We're all in this together had a ring of truth to it. On May 13th, Governor Hogan announced the beginning of Maryland Strong Roadmap to Recovery Phase 1. By that time, President Trump had encouraged protesters to mobilize against stay-at-home orders, suggesting that they were government overreach and a violation of individual rights. Small businesses were nearing the point of no return when the weight of debt becomes too heavy a burden to bear. Frustrated applicants for unemployment insurance had gone too long with no income and no answers. Parents were desperate to get their kids out of the house and eager to get back to work, but concerned about the absence of childcare, a concern that still exists today. With a failing safety net and a flattening curve, people were exactly where our public health professionals said we'd be if our containment efforts were effective. People were restless. Central Maryland county executives, the ones leading counties where 90% of the state's positive cases are recorded, were surprised by the governor's May 13th announcement. On a call the day before, the last of his weekly calls with us, he suggested that the announcement might include curbside pickup and retail businesses and outdoor religious gatherings. The next day, he announced that 50% of fire code capacity would be allowed inside both non-essential retail and houses of worship. During that same announcement, the governor left it to each county and each municipality to move forward at their own pace. I cannot overstate the impact of that announcement. On social media, it was like lighting a match in a room with a gas leak. People now had local targets for their frustration, their own local governments. I, like my peers in the Big 7 counties, consulted with our health officer and made a decision to move forward cautiously. At that time, Maryland was listed as trending poorly on COVIDexitstrategy.org, and our positivity rate was the highest in the country. The 4 pillars in the governor's roadmap were not actually metrics, and with the responsibility for reopening decisions transferred to counties, we needed our own metrics to guide decisions and inform our residents. We established them. Before May 13th, our local government's efforts were primarily focused on meeting our residents' needs, establishing our food distribution system, creating our eviction prevention program, calling our seniors every week to check in on them, creating our small business employee and customer protection grant program, and a list far too long to cover today. After May 13th, a very complex and controversial process of reopening began, county by county, and in some cases, municipality by municipality. It seems simple, but every county is learning that it's a complex puzzle where every piece must fit. So here's where we stand in Anne Arundel County, the best place for all. First, our health metrics must demonstrate that we can begin a recovery that is likely to continue. In the past week, we went from 3 goals achieved to 7 out of 12, with real progress underway on the others. The big development is that our testing capacity is growing, and that combined with our universal contact tracing and case management, that allows us to isolate the virus in ways that we could not just a week ago. The second area of good news is that our businesses and some of their trade associations have invented new ways to operate with very little chance of spreading the virus. I learned yesterday on a call with 60 faith leaders that they are doing the same. Our local institutions are fully committed to winning this battle, and they are looking to government as a partner that listens and leads to create a level playing field and a safe path to recovery. The third part of the reopening puzzle is government regulation and redeployment of staff. Outdoor seating at restaurants normally requires a permit. Public pools are required by state law to be inspected before opening. Our Office of Law and Permitting staff are cutting red tape like it's never been cut before to make reopening possible. So I want to thank all of my staff for putting in the long hours and thinking outside of the government box to allow us to move forward quickly. So, as a result of this progress, beginning today at 5 p.m., non-essential retail businesses that are currently operating under curbside pickup only may open to customers. The maximum number of occupants will be calculated based on 150 square feet per person. I will note here that we are the first county in Maryland to shift from a fire code standard to one based on floor space. Some have questioned why the area we chose is larger than what is required for 6-foot distancing between 2 set points. And the answer is that we want people to be able to move within the walls of the building while still maintaining distance. Businesses will be required to have protective measures in place to encourage physical distancing, and face coverings will be required for everyone in the store. Specific details on this guidance and others can be found at Road to Recovery on our aacounty.org website. Food service establishments, which include restaurants, bars, and social clubs with dining facilities, may serve food and beverages for consumption in outdoor seating areas in accordance with the new state guidance. Our County Office of Plan and Zoning will authorize outdoor seating as a temporary use for up to 180 days unless or until the emergency is lifted or revised by executive order. A special permit is not required for this temporary use if it complies with the standards set forth in the guidance. And I will note that without the emergency powers granted to us by our county council, this opening today would not have been possible. Barbers and beauty salons may open for hair services only. The maximum number of occupants will be calculated based on a smaller 100 square foot per person due to the necessity of proximity between employees and customers. In addition to these openings, starting today at 5 p.m., our parks will reopen their pavilions by reservation, the dog parks, beaches, and all with the warning that Governor Hogan's ban on gatherings of more than 10 people is still in effect. Swimming at county or community beaches is no longer prohibited, but swimmers are warned that no routine bacteria testing has been conducted. That testing should be completed within 2 weeks. And finally, private youth camps may operate in groups of 10 or less, according to state guidance. And limited activities on county park athletic fields will be allowed starting on Monday, in accordance with state guidance. Public and community outdoor pools will be open in the coming weeks as they pass their state-mandated inspections. We are awaiting further explanation from the state on conflicting pool capacity guidelines. As noted earlier, I hosted a call yesterday with 60 of our county's faith leaders. Each one has continued their ministry, and all are working on plans to responsibly transition to indoor services, some as soon as possible, and others as late as fall, depending on conditions. I and our health officer believe that socially distanced indoor worship is possible with safety measures in place. And we are reviewing the information we have collected to establish guidelines that will be released in the coming days. The following facilities remain closed, most in accordance with state requirements: senior centers, fitness centers, movie theaters, common areas in shopping malls, nail salons, playgrounds, county park visitor centers and restrooms, indoor aquatic centers, and recreation centers. So this progress comes with a risk. People will be out and about, and our mobility metrics will gradually return to pre-COVID levels. Anne Arundel County had 2 new positive cases recorded on March 23rd, the day that businesses were shut down. Yesterday, we had 108 new cases. This virus is being carried by more people today than it was back in March. So we are more vulnerable now than we were then. If we fail to wear masks and distance ourselves from one another, the spike in infections will be larger and faster than what we've seen so far. And it will happen as our hospital COVID capacity declines due to the return of non-COVID patients. The history of pandemics warns us about the strength of a second wave. As we reopen, we are shifting the responsibility to limit the spread of this virus from government to the public. So when we say we are all in this together, the words have more meaning and urgency at this moment than ever. Dr. George Everly is a world-renowned psychologist who specializes in disaster recovery. In our recent town hall, he issued a warning. Division delays recovery, he said. Please remember those 3 words. Division delays recovery. So we have a choice, and it's one that must be made both by our residents and our leaders. We can choose either Maryland strong or Maryland divided, but we cannot have both. I say that to Governor Hogan in the hope that he will re-engage with local leaders. I say that to ambitious local politicians who sometimes seem deaf to the pain caused by wedges driven too deep. And I say that to the good people I represent, even if they believe that I have overreached and used the tools of government in ways that they don't support. Online threats may feel satisfying in a moment of bravado, but they are an insult and a nuisance to our public servants in law enforcement. Calls by elected officials for residents to break our laws in protest are cowardly attempts to attract attention. Demands to weaken state and local government while seeking public assistance in a time of need ring hollow. We are fighting a war on two fronts, one against this virus and another against poverty, hunger, and homelessness, the harsh realities of economic loss. Every one of us wants to win both battles. Our preferred strategies may not always be aligned, but we are on the same side. So I plead with every resident of this county, please embrace this moment, be kind to your neighbors, and finish the job we started. Thank you. Dr. Nilesh Kaviaraman, our health officer, is going to say a few words, and then we'll have our police chief for a moment, and we'll take questions.
Thank you, County Executive Pittman, for your thoughtful leadership during these challenging times. I am Dr. Nilesh Kaviaraman, the Health Officer for Anne Arundel County. These are tough times. COVID itself is dangerous and has taken a toll on our county, both from illness and the deaths to the disparate impact upon those at higher risk, people older than 60, those with chronic illnesses, African Americans, and Hispanics. Our response has been broad measures to drastically decrease our activity, and it's strained our social and economic well-being. And so as we make progress and get targeted measures in place to move into recovery, we have the opportunity to come back together to work towards a common purpose. Everyone plays a role in how we move forward. While each of our actions may seem small, and the risk may seem low from any given activity, when you add up the countless decisions each of us makes every day, the collective impact is massive. That is why your actions matter. And there are steps that each of you can take to make sure that our recovery is sustainable. One is making sure that you wear face coverings anytime you go out. They work in slowing the spread of the virus. I know they're not that comfortable, and yet they're one of the most effective ways for you to prevent spreading it and from you to get it. Physical distancing, keeping 6 feet from others who are not part of your group when you are outside of your house, continues to be important. Hand hygiene, washing your hands when you're out, when you frequently touch surfaces. We've talked about these 3 things, and these are the things that are going to be necessary to keep doing as we go forward. This is our new normal. At the same time, if you start to feel sick, you should know and do the following 3 things. 1, know the symptoms. When we first started talking about this, we talked about fever, cough, and shortness of breath. But we know there are additional symptoms, such as chills, muscle aches, headaches, loss of sense of smell or taste. Be aware of these symptoms. And when you have them, stay at home or where you are. Usually we push through these and we go out, or we send our kids to school, and all of us are guilty of having done this. As we reopen, it's essential that you not do this. It won't work anymore. And as part of that, we're now encouraging you to get testing within 48 hours of having any of these symptoms. This is important both to get care for yourself and so that we can break the cycle of transmission. This is different from what we said when the outbreak started. So 2 things have changed. 1, we have more testing. We have enough for everybody to get tested. And the second is that as we increase our activity and we have more interactions, it's that much more important to identify people with symptoms who have COVID. And we can do that through the third thing, through contact tracing and case management. When you're positive, we call you to let you know that you're positive. We talk to you about isolation and make sure you have the supports that you need to stay in isolation. Importantly, we also find out who your close contacts are, contact them so that we can quarantine them for 14 days, and this is what breaks the cycle of transmission. To make this happen, our contact tracers need you to pick up the phone or return our message. All of this is hard. We all want to go back to way things were, but we can't. This requires us to change how we go about our day. Our old routines aren't suited to our new reality. Every action requires thought, and it's tiring. And so my last recommendation is to be kind. Be kind to yourself and recognize that this is hard. Find space for enjoyment in this time. Be kind to others. Others are struggling with these issues, and your grace may be the thing they need to make it through the day. With each of us doing our part, we are stronger, and we set ourselves up for a more sustainable recovery. I'm going to turn it over to Chief Altamari.
Good afternoon, ladies and gentlemen. Thank you for coming out. I want to open by thanking my boss, Mr. Pittman, for continually doing these press events. Information is important in something like this, and it's been tough to keep doing it when he was getting punched on the chin the whole time. I think it took courage. I'd like to thank our Office of Law for giving guidance out to the officers. I want you to think about something. We're in our 6th or 7th iteration of executive orders. It's tough to remember exactly what's said in these executive orders as the cops are out there in between other calls for service. So the Office of Law has been really good at getting us rubber meets the road guidance, and I appreciate it. Government exists primarily for one prime directive, if you'll let me use a Star Trekism. Our prime directive is to keep people safe, to keep lives going. We are without a doubt in one of the most stressful times in our national history internally. People are done being inside. I get it. The county executive gets it. Dr. K gets it. Everything they're doing is aimed at keeping people alive. Every one of us has a 15-year-old cousin or a 15-month-old niece or nephew or daughter or son or a 105-year-old grandmother. When this disease gets into those people, it kills them with alarming frequency. So the decisions that have been made are not grandstanding. I want to say this. I try not to get political very much. I've watched the 2 men in this front row talking about what's going to happen if they do this or don't do that. I watched the look on Mr. Pittman's face when Dr. K told us a couple months ago that about 6,000 people were expected to die in Anne Arundel County. And that if we didn't do the things we've done the last couple months, that number might be higher than 6,000. We're over 100 deaths. That's a win, but it's still 100 and whatever many deaths too many. I'm asking folks to stay the course. Bear with us as we move forward. I'm very proud of you, Anne Arundel County, that you have not forced my cops to make one arrest solely for an emergency order violation. That's pretty remarkable for a county our size. I appreciate it. I'm also proud of the cops for being the diplomats that they have been during this pandemic. I'll close simply by saying this. In a couple years, we will look back on this and define personally for ourselves how we handled it. If our decisions weren't made to keep other people safe, we will regret that for the rest of our lives. Keep that in mind for me. Thank you. I'm going to step down, and I think, boss, I'm supposed to say we'll take questions, yes?
We have time for a couple of questions, the county executive, and when you guys answer the questions, if you can repeat them generally into the microphone so we can.
County executive, you've described the situation between the local leaders and the governor as being a little strained. Where did this relationship break down, and what are you and other leaders looking for from the governor to get things back on track?
What we're looking for is communication. We would love for him to participate once again in the weekly calls with his staff. Those calls are not just the big 7 counties, but county leaders across the state. We would like to be a part of the road to recovery planning. There are task forces that include business interests, but no government interests. So there are no local government representation. And we would like notice in advance so that when a new order or a new opening is announced, that we can do the work that we need to do at the local level to be able to prepare for it and have time to consult with our health officers about how we'll implement it locally.
County executive, with the 150 square foot per person, 100 square foot per person, how close is that to the 50% capacity?
My understanding is 50% capacity is based on fire code, so there's some factors that have nothing to do with square foot, open entrances and things. In most cases, it's less. I think the smaller buildings, it's a little bit more less. But we considered the possibility of a 25%. We considered, of course, going all the way to that. And when we looked at the 150 square foot, it tended to put us in between the 25 and the 50.
County executive, you described the granting of more or wider local authority by the governor as being tantamount to lighting a match in a gas-filled room. The governor says that local leaders such as yourself asked him, he used the word begged, for that kind of authority. Is your description now a reflection of perhaps buyer's remorse?
No, because we didn't ask for local decision-making authority about the pace of recovery. We asked for conversations in advance of the decisions, and some of the smaller counties particularly asked for a tiered approach where they could move forward more quickly. And we all expected that if that were to happen, it would happen the way it has in Virginia, Pennsylvania, New York, where the governor creates the tiers based on what his health guidance, professionals are saying about how the pace should move in each. So I would say it's not buyer's remorse because we didn't ask for it.
The governor has a tiered plan that he's released. Is he not following that plan?
He has phases and he has pillars in the roadmap. The 4 pillars are the PPE, the hospital census, the contact tracing, and the testing. The phases have been they're rough. They're not specific about what's going to open. And what he's done is he's taken pieces from different phases. So the houses of worship was actually in phase 2, and he used that in phase 1. He did a partial phase 1 before he did the whole thing. So it's a guidance, just like our metrics are a guidance. So it's hard to know what's coming next in terms of the announcements, and that's been part of the frustration. Is it's hard to plan a recovery not knowing the orders that are going to come down from the state.